Dr. Rosemeyer, could you please introduce yourself to the jury by stating your full name and which party you will be acting for?
Yes, I am Dr. Jessica Rosemeyer and I am a clinical psychiatrist and have been instructed by Sandshaw Solicitors to testify as an expert witness on behalf of the Defence Counsel to determine whether the defendant, Mr. Joe Davola, had suffered a psychological condition at the time of the alleged assault on the 27th of December 2014.
Defence Counsel, you may begin.
I graduated from Monash University in 2006 and received my PhD in 2009. I have since had 6 years' experience in diagnosis and treatment of adults with schizophrenia, psychosis, depression and anxiety. I have worked closely with the adults in particular with diagnosis of schizophrenia and other forms of psychosis. Not only have I conducted a diagnostic test for these clients, I have utilized resources such as the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM, to advance in or implement treatments appropriate to each individual. I also make it priority in my practice to consider prognosis and other possible diagnoses and a wide range of treatments appropriate to the specific condition. I met with Mr. Davola on the 4th of February of this year. On this day, Mr. Davola was physically agitated and had been tapping his fingers on the armchair. His speech was incoherent and disorganized. Mr. Davola would snap from becoming aggressive 1 minute to completely still and appeared almost paralyzed in unusual positions. Mr. Davola had trouble recounting the events on this day in a logical order. He was able to describe relevant incidents, however often confused the facts of how these events unfolded. Minor details such as the position of where the victim was at the time of the offence were left out on his recount. Mr. Davola understood that his actions were considered illegal through the injury he inflicted on the victim. However, he wasn't able to understand why they were illegal. He attempted to justify his actions, but there was no evidence that he was able to understand why they were wrongful doings. Through diagnostic tests conducted by myself, I have concluded that the characteristics and symptoms that Mr. Davola exhibits are within the diagnostic checklist for schizophrenia, featured in the DSM-5, therefore making the diagnosis of schizophrenia fitting to his circumstances. Patients with schizophrenia often have poor executive functioning. They are unable to understand or make sense of external information. Mr. Davola was unable to identify why his actions were illegal and could not comprehend that they were wrongful. He persisted that he was not only saving his marriage, but doing what had to be done. According to the DSM-5, schizophrenia is a disorder in which interferes with an individual's ability to think, feel, and behave. A few symptoms that are typically present within schizophrenic patients are delusions, hallucinations, disorganized speech, social dysfunction, and catatonic behavior. Catatonic behavior is a term that we use for extreme behavior. On one end of the spectrum, it can involve the inability to speak, move, or respond, and on the other hand, it can involve hyperactivity, bizarre movements, and also inappropriate behavior. I interviewed Mr. Davola and examined his behavior, cognitive and emotional state. Upon this analysis, I referred to the DSM-5 and concluded whether or not Mr. Davola had satisfied the symptom checklist that is required to form a diagnosis of schizophrenia. I also assessed Mr. Davola's MRI scan results conducted by Park Hill Medical Center in order to rule out any chances of a brain tumor. I recommend that Mr. Davola received cognitive behavioral therapy for his experiences of psychosis. I suggest that he attends a total of 16 planned sessions. In addition to this, I will prescribe Mr. Davola chlorpromazine to reduce any aggressive symptoms and to control his delusions.
I would like to now invite the prosecution for cross-examination.
Yes, that is correct. During adolescence, Mr. Davola was a frequent user of cannabis. Studies such as one conducted by Moore in 2007 have proven that there is a correlation that cannabis use at an early age can increase the risk of psychotic symptoms later in life. Mr. Davola's father also suffered from autism spectrum disorder, and according to Owen, Craddock, and O'Donovan, genetic risk factors that are linked to the development of schizophrenia, in some cases, those with a family history of ASD, have a high contributory factor to the development of schizophrenia. Yes, I have taken into account and considered delusional disorder. Certainly. According to the DSM-5, delusional disorder criteria describes a prominent feature of false beliefs. Delusional disorder branches from paranoid personality disorder and can be defined as bizarre beliefs. Despite the fact that Mr. Davola shows the symptoms of delusional disorder, he also shows symptoms of disorganized speech and dysfunctional behavior. The DSM-5 has clearly defined these symptoms and show the distinct variance between delusional disorder and schizophrenia. An interview is important to gain a better understanding of a client's cognition, behavior, and their emotional state. To be diagnosed with schizophrenia, an individual must first and foremost meet the criteria outlined in the DSM. I have chosen to utilize the 5th edition of the DSM as its reliability and validity is a more accurate form of assessment ahead of other diagnostic tests. According to Astrachan and other researchers in 1972, a symptom checklist is effective when it is able to differentiate symptoms between disorders. In a more recent study, Tandon 2013 has maintained that the DSM-5 successfully achieves a more clear and distinct criteria of a schizophrenic symptom, making it easier to clinically diagnose. The National Institute of Health and Care Excellence have urged that cognitive behavioral therapy enables clients to form a clear link between their thoughts and their behavior, while understanding the symptoms of their disorder. A study conducted by Smith and other researchers in 2003 concluded that it is not only important to address the symptoms through biological measures and drugs, it is also important to address the link between cognitive and behavioral causes.